Hello, my name is Dr. Virginia von Schaefer, and I wanted to talk to you a little bit more today about differences between traditional approach to cancer treatment and integrative. It's always a big question for patients when they come to a diagnosis of cancer, whether it's for themselves or a family member, is what to do. What's the best thing to do? And how can I find that treatment? So I'd just like to talk to you a little bit more about what I see patients thinking about and concerned about. In traditional treatment of cancer, patients are basically categorized according to their cell type and their stage at the time of diagnosis in their particular cancer. And then they're funneled to treatments that are established regimens, pretty much what they call standard of care. And this can involve a certain group of drugs that might be applied if chemotherapy is appropriate, a certain type of surgery if that's deemed a patient is a candidate for, or radiation therapy. And there can be varying combinations of all of these. Say, for example, in breast cancer, a patient may be diagnosed to have estrogen receptor positivity, progesterone positivity, and HER2 positivity. Well, that patient is going to be recommended to have probably some chemotherapy involving immunotherapy or Herceptin to shrink the size of the tumor, and then have a surgical intervention, possibly radiation therapy afterwards, and then on the basis of the lymph node dissection and status of that sort of thing, might be recommended for other treatments. But certainly we'll have the recommendation of getting a standard of 12 months of Herceptin and most likely even another drug called Perjeta. Well, the truth of the matter is not every person is the same, and so not every individual's needs are the same. And an integrative approach to a patient like this would be more to assess, number one, do they have any underlying conditions that might predispose them to cancer? And yes, there are the genetic markers, that's true. And yes, there are tumor markers. We can look at those as well. But in my practice, we emphasize looking at surreptitious infections that may have contributed to the development of the cancer and may also contribute to perpetuation of it and recurrence. So when you look at that, you get a little bit broader picture of how the patient got it and what we can do to prevent it from coming back. We also have the situation of other factors in an individual, their age, their ability to withstand treatment. Integrative cancer treatment always involves modification and lowering the doses of chemotherapy. But in my practice, we also test extensively for chemotherapy sensitivities to the person's individual cancer cells, so that if a standard combination of medications may or may not be the optimum one for that patient. So we like to test and see what's going to work the best on the patient's problem. This is very different. The other contrasting factor is that traditional chemotherapy and administration of it doesn't test or take into account or treat drug resistance. And there are many mechanisms that cancer cells have developed to deactivate or eject chemotherapy from the cell before it even gets a chance to work. So when we test for those resistance factors, we can modify the regimen to counteract them. The other thing has to do with the fact that not everyone can tolerate high amounts of drug. And so a lower dose is often what people tolerate better. Now you say, well, what's the difference? I mean, why should we do a lower dose? I mean, shouldn't we use a lot of drug and, kill all those bad cells at once? Well, the problem is many chemotherapy agents are indiscriminate in terms of their cell killing. So Say, for example, alkylating agents will kill all cells that are dividing. So that means the good cells that are dividing are going to die just like the bad ones. Well, then we have the other issue is that who's the cleanup crew? The cleanup crew is your immune system. And if your immune system is impaired so that you end up getting the cancer to begin with, if you do too much cell killing at once, the immune system isn't going to be able to clean it up. So the mainstay of therapy in integrative cancer treatment is small bits of killing, not big amounts all at once. This seems to make a huge difference for patients. Thank you.